So we continue our talk about the CBT, and as I mentioned, every time we discuss a new problem and how CBT can help with it. So today we want to be talking about obsessive compulsive disorder, and we're going to talk a little bit about a general overview of the problem, symptoms, signs, and stuff like that. So I'm sure some of you or most of you have an idea about this disorder or disease. But by the way, we call all mental health problems disorders. We don't call it disease because we are not sure what is exactly the causes of the problem. Okay, and we're still not sure 100% about the management. So this classification, OCD and anxiety, depression, addiction, different classification, we call it disorder because we can't fully understand the mechanism and the treatment for the problem. But as far as we know, is OCD is unwanted thoughts and fears, and that can lead to repetitive behavior. We call these thoughts obsession, and we call the behavior that happen after the thoughts is compulsion. How common it is 1% of population suffer from OCD. It is more in females, and there is a high risk for having OCD during pregnancy and postpartum. Also, the genetic factor is important. If you have first-degree relative with OCD, does it increase the chances that you may suffer from OCD? Usually, it starts at young adult years or teenagers. It's very rare to see someone that start to have OCD at age 60, for example. Usually, I see people around 20 when the problem starts. Usually it started gradually, so it began gradually. However, I have some patient where the OCD start suddenly. So I have some patients, they tell me, you know, at age 23, the OCD started on my birthday, because I remember the first day when I become obsessed about contamination and washing my hand. So usually it is gradual, but for some people, start sudden, and they can tell you when and where the OCD started. We know also OCD get worse with the stress and anxiety. So around exam time, or if there is relationship problems or stuff like that, your OCD will get worse. There are some risk factors or some personality traits. When you see them, these factors could be a risk for developing OCD, like people who are indecisive or have ambivalence problems, kids who have separation anxiety. Like separation anxiety means it's severe anxiety when you are separated from your primary caregiver, people who are resistant to change, people who avoid risk at all, they don't like to take risk at all, people who are oversensitive, perfectionists also have a higher risk or higher chance of developing OCD. People who are hyper-religious or have hyper morality. People who are workaholic or excessive devotion to work could be a risk factor. These are personality traits that we can say commonly associated with OCD. OCD, the same as most of mental health problems, there is serotonin is involved in the problem, glutamate, dopamine. These are the main chemical transmitters that involved with the problem. Anyway, I don't want to, talk about over scientific stuff, like too much details about which area is affected, but there are certain areas in the brain where we can see is affected when you have this OCD, when we take functional MRI images. Anyway, again, the symptoms are obsessions and compulsions, okay? And again, obsession means thoughts, but these thoughts are intrusive and distressing and persistent and recurrent. You try to ignore them, suppress them, or neutralize them, or do something about them, but they keep coming. Okay. And they are different from hallucination. Hallucination, when you, like with psychosis or schizophrenia, or if under influence of drugs, you hear voices. Okay, this is different from these thoughts. These thoughts, the patient will report that thoughts are coming from my mind. It is not from outside. It is my mind bringing them. Usually there is common themes around obsessions. The most common one, and I'm sure you heard about it, is the contamination. Like people who are obsessed about the contamination and they worry too much about the infection they get from others. Okay. And this obsession can lead to compulsion, which is a repetitive behavior of hand washing. So you see some people with this obsession, they wash their hand 20 times a day, every time like 10 minutes. If you calculate, this is lots of hours are wasted in this process. And that's why this obsession can cause impairment in function, impairment at work, or dysfunction at work, at school, with relationship. It causes lots of problems. Also, a common theme is the pathologic doubt. When you worry about doing things incorrectly. And the most common one is like you check the door and you are not sure if you lock the door or not. Then you go check again, then you go check again, then you go check again. Or the oven, stuff about safety. And the compulsion will be excessive checking. These are the most common ones: contamination and the doubt about you did something wrong or right or incorrect. Also the thoughts about symmetry and order. You want things to be in certain orders. You want your shoes to be in certain orders. You want your pencils to be in certain order or arrangement. This is another one. Aggression also is a common one. Is you have intrusive, usually it is images, not thoughts, like an image. So an image of you driving into a crowd and you killing hundreds of people. Okay, you don't have any intent. You are not an aggressive person. You don't have any intentions to hurt other people or to harm others, but these thoughts keep coming. We call this obsession, but aggressive obsession. Also, sexual obsession is common too, like pornographic images that keep coming. Usually like deviant sexual behavior, pedophilia, incest, things you will not accept at all, but they keep coming. Or you have thoughts of acting in a sexually inappropriate way in front of others. Also, religious thoughts is common in my country, because when you live in a religious place, like a religious culture, based culture, so people have lots of obsession about committing a sin or doing something wrong. For Muslims, for example, or Christians, like when they pray, do I pray right? Do I mention the right prayer, or do I repeat the right prayer? Or when Muslim wash before they pray, did I wash everything? Did I lift my hand like unclean? Stuff like that. Also, superstitious obsessions, when you are afraid of certain numbers or colors, like black colors bring thoughts or bring a negative vibe or something like that. So anyway, but as you know, contamination and doubts about things you do are the most common ones. So these are, again, intrusive thoughts, have different themes. Contamination and pathologic doubt is the main one. Anyway, as I mentioned, there is part of the diseases, we call it repetitive behavior or compulsion. Usually, these are the most common repetitive behavior, like checking the doors, checking the stove, washing, counting, needing to ask. Like, for example, like I have a kid who keep ask his mom, do you love me? All the time, like 50 times a day. Do you love me? Do you love me? Say I love you. Do you love me? Do you love me? And then the mom was worried at the beginning. that she's not offering him enough emotional, connection, affection, stuff like that. But it turned out that the kid is struggling with OCD because he had these thoughts: your mom doesn't love you, your mom will abandon you, okay, or disown you. And then he asked her continuously, do you love me or not? So the thoughts are coming, but he is a child, he doesn't express it. But what you see is a compulsive behavior where he asks his mom, do you love me or not, to get reassurance. Anyway, compulsion for symmetry, you put certain things in certain arrangement or order. Hoarding is another common compulsion. Prayers, keep praying, keep repeating certain words or certain sentences silently. Anyway, when you have thoughts and this leads to repetitive, so you have fears about contamination, and then you wash your hand 20 times. Why you do this? Because this relieves the stress a little bit. Okay, but we will know now how we do the therapy. We have to break the cycle. You have the thoughts, you wash your hand, this reduce the stress a little bit, but the problem, if you keep doing this, it's gonna reinforce the OCD cycle, and we have to break this cycle. Anyway, thoughts, compulsion. Okay, if we want to understand the psychodynamic of OCD or the cognitive dynamic of OCD, you need to know that, because this will lead us to the exercise or the CBT exercise. Is we all have an anxiety, and it is a protective factor to have an anxiety. This is the alarm system that is built in for survival benefits. So an anxiety is good within limits. Alarm system, we all need alarm system, okay? Because when you experience or you perceive dangerous situation or danger, you experience fear. Then you try to avoid the fearful situation. For example, you're driving too fast, you experience an anxiety because it's gonna protect you. The problem, so an anxiety is alarm system and it is protective. But the problem with OCD, the alarm system is triggered too easily and more intense and more frequent. Again, the OCD is your anxiety alarm system is triggered more frequent, okay, more intense. It's like a short fuse. There's something, can't put brakes, you can't, and easily triggered the alarm system. So it gives a false positive, false negative, false positive all the time. So if you have fears, we all have fears about contamination to some degree. So if you have fears about contamination, you feel your hand is contaminated, you wash your hand 15 seconds and done. The alarm will be off. Sorry, the alarm will stop working, will stop beeping because you are done. The source of anxiety is gone. But the problem with people with OCD, the alarm will continue going on, more intense, more frequent. So you're gonna wash your hand not 15 seconds, you wash your hand 10 minutes. Okay, and every time you wash your hand, the anxiety is temporarily relieved. But then you wash, the obsession come again, then you wash again, then anxiety go down a little bit, then you wash it, so the thoughts come again, and so on. I don't know if I tell you, if I think in one of the seminar I explained this cycle before. But this is what I was talking about. This disorder start with thoughts. Did you turn off the oven or not? This is a thought, and we call it obsession. And then become consistent and persistent and recurrent. Then these thoughts, did I turn off the oven or not, cause an anxiety. You start to worry about, did I turn it off? Was it on? Was it off? This caused an anxiety. To relieve the anxiety, you will go and check to confirm if the oven is off or not. We call this compulsive behavior. And when you go and check, no, the stove is off or the oven is off, okay, you get relief. Perfect. The cycle is good. Okay, you get relief. The problem, when you get relief, this reinforces the obsession. So the obsession will come more. and the obsession will cause more anxiety. So when you go check again, and every time you check, you get relief. It become rewarding cycle. Then your thoughts come again, and then an anxiety, then you check, and so on. You do this for hours a day. Even you drive from work to home to check if the oven is on or off. So cause lots of impairment, distress, relationship problem, work problem, lots of problem. Okay, how are you going to treat this? Of course, the medication is one of the main treatment for OCD. With anxiety or the depression, sometimes counseling is enough. Some people will need a medication, but with OCD, the biological factor is very big in the treatment, and lots of the patient is tended to be a chronic problem, this problem, and lots of patient will need medication. It's not like an anxiety. If it is mild, no, we can fix it with just counseling. I don't need our exercise or change your diet. I believe like as a biopsychosocial, but this one, I think the medication are very crucial in treatment. Anyway, how are you going to do counseling for this? Like CBT counseling, what you do, you break the cycle, you stop. You ask the patient, I want you to be exposed to the cause of the obsession. And then you're going to feel the anxiety. It's fine. We call it exposure therapy. I want you to be exposed to the contamination, and you will feel stressed, but don't do anything for 2 hours. Don't wash your hand. Going to be very stressful, but this is how we can break this cycle. So again, we call it exposure and response therapy, which you're going to be exposed to the source or the trigger of the anxiety. Then you stop the compulsive behavior, and this will break the cycle that I was talking about. Then the obsession and thoughts will become less repetitive, will become less recurrent, will become less persistent. Okay, is it comfortable, this treatment? No, it's completely uncomfortable. Lots of patients, they don't want to face their fears. Okay, also part of the treatment is we create hierarchy of triggers and anxiety. So we tell them, tell me what is the most distressing thing that trigger lots of obsessions and fears. And they create a hierarchy. And here is an example. We ask the patient to tell me, all the triggers, all the anxiety and the obsession triggers. Okay. So they tell you, okay, the themes usually is about contamination. Okay, give me example. Things that trigger tons of obsession and anxiety. They tell you, oh, using a public washroom, or shaking a stranger hand, or touching money, or handling money, or touching a doorknob in a public place. And then you tell them, okay, assess every trigger from 1 to 10. Which one is the worst? Oh, using a public restroom, this is the worst trigger for my OCD. Okay, we tell them, okay, we are not working, we will not start working on this one. Maybe touching a door knob is a first to start with. And some people, even you tell them, okay, touch the doorknob and then don't wash your hand for 2 hours. For some people, it's very difficult. Sometimes you ask them, okay, don't touch the doorknob, just touch with your finger. Let's start with a finger. Then if you are able to do that for 2 hours without washing your finger or your hand, let's touch 2 fingers. So you see, we build a hierarchy of things that are very fearful and that are very triggering for your OCD, and we start with baby steps. To get rid of OCD by CBT, you need to do this exposure and prevention every day. And if it is so bad, sometimes you will need like a rehabilitation set to be admitted in a hospital, and you start the treatment with a therapist within in a hospital setting, because some people is very bad. Anyway, but the real treatment is real life exposure. You need to be exposed, as in refrain from the compulsive behavior. Okay, this is the main idea for treating OCD. But again, usually we need medication, and usually it is a SSRI, like medications that work on serotonin. Sometimes we combine these meds with antipsychotic to help with controlling the OCD. Anyway, mental compulsion is the same strategy, so I don't have to go through this slide. It's the same thing. You expose yourself to a mental obsession and then try not to do any compulsively mental reassurance or something. Anyway, the exercise. So to summarize what I was talking about, there's something called OCD. Usually it includes obsession and the compulsion to relieve the stress, but it become like addictive cycle, the compulsive behavior. So we want to break this cycle, and we also want to include some medication to help fix the problem. Anyway, the exercise today is you can build this hierarchy today. You can think if you have mild to moderate OCD and you want to share with us what is the themes for your OCD and how you can work on them. Again, you'll need a therapist to work with you if it is very severe or severe forms of OCD. If it is mild, you can do it with this exercise. The OCD for today exercise, I want you to build an anxiety or OCD exposure hierarchy. So if you have certain obsession or compulsion and you know the triggers for it, you want to face your fears, you create a hierarchy. What is the least distressing situation? Then go higher and tell us what are the level you're going to go through. But I know lots of you don't have OCD. You can replace the OCD with an anxiety, because we treat an anxiety also and the phobia with exposure therapy. So if you have phobia to animals or you have phobia or social phobia, for example, you can create a hierarchy on how you're gonna face your fears. Even general, it doesn't have to be specific phobia. It could be general fears you have in life or challenges, and you like your comfort zone, but you wanna, in the new year, challenge yourself and face your fears. So for example, someone with social phobia, they can build a hierarchy. Maybe they can start with saying hi to strangers. Then if he can do that, he can talk to co-worker, start a conversation with a co-worker. This is the second one, or do online dating or go on a date. Maybe this is the third level, and so on. So I want you, if you have certain fearful situations, or if you have OCD, you want to tell us about specific obsession and how you're going to target them. It's fine. If you don't have an anxiety or OCD, maybe because we are starting the new year, tell us about a goal. We did this on Tuesday, so I like to do it today too. Tell us about a goal and how you are going to achieve this goal. But when you tell us about the goal, try to use the SMART acronym, right? We use it all the time. So tell us about a specific goal and how you're going to measure it, like a measurable goal, and attainable, like you can achieve this goal, and tell us how you're going to achieve it. Something relevant to you and your values and your life, and also something that is time bound or it has a time frame, like you're going to achieve this goal in a month or in a year or 6 months, something like that. Anyway, so we have two exercises, one about OCD and an anxiety exposure hierarchy. If you have certain things that you want to challenge yourself to be exposed to, whatever it is, OCD or just a general anxiety or specific phobia, also tell us about a goal that you want to achieve in the new year, and be specific, and the goal measurable, attainable, relevant, and the time bound. I'll give you a few minutes to think about this stuff, and we will be back in maybe 5 minutes. Thank you.